Hello everyone, my name is Bassel. I'm a student at Technion, and today I will present our work beyond local processing, adapting CNNs for CT reconstruction. And this is joint work with Dr. Yuval Bahat from Princeton and Professor Michaeli, my advisor at the Technion. Now let's begin with some background. CT, computed tomography, is one of the most popular medical imaging modalities, with 75 million scans each year in the US. CT is a very powerful diagnostic tool used to identify a wide range of pathologies such as tumors, bone abnormalities, lung disease, and it's also used as a guide. So how are CT scans done? During the scan, the gantry rotates and irradiates the patient at various angles, also called projections. The incoming radiation is partially absorbed in the tissue of the patient, and what's left is detected on the other side. The resulting projections form the sinogram, which is the Radon transform of the scan slice. Note that each row of the sinogram corresponds to one projection of the patient at a certain angle. Now, from the sinogram, we can reconstruct the image using the filter back projection algorithm, or FBP algorithm, by filtering the rows of the sinogram with the Raman filter and then back projecting or smearing each row along its corresponding angle to form a 2D image. Great, so now we know how to reconstruct high-quality images. The problem, however, is radiation. As we scan more and more angles, radiation dose of the patient increases. One of the naive solutions here to lower the radiation is to simply scan fewer angles. And if we do that, we'll have a smaller sinogram with fewer angles, and indeed a lower radiation dose, but the quality of the FBP reconstruction will be very poor. It's riddled with streaking artifacts to the degree that informed medical diagnosis is impossible. The question is, can we enjoy both worlds, namely a high-quality image using little radiation? And we try to achieve this using deep learning, more specifically CNNs. Now, CNNs have shown extraordinary performance in many tasks, such as super resolution, denoising, and deblurring. And common to all of those tasks is their local nature, namely that each pixel in the degraded image is affected by a small neighborhood around it in the ground truth image. Now, since CNNs predict the value of each pixel in the output from a small neighborhood around it in the input, defined by the CNN's receptive field, this is indeed a good fit. The bottom line here is that CNNs process the data locally, and this assumption of locality is violated during CT reconstruction. Let's see how. For the sake of simplicity, consider an image of a delta function and its corresponding small sinogram. The resulting reconstruction using filter back projection looks like this. Notice that the artifacts are spread across the whole image and are not constrained to a bounded region around the corresponding pixel. Basically, CT reconstruction is a highly non-local task, which makes the naive use of CNNs suboptimal. To partially circumvent this problem, people have usually resorted to the incorporation of pooling and unpooling layers in CNNs, and this results in a staggering increase in the receptive field, but it comes at the cost of very large and deep networks with many learned parameters. Now let's see how CNNs have been used for CT reconstruction. Now CNNs in CT largely fall into three categories. Methods that operate in the sinogram domain, which then reconstruct the image typically using filter back projection, which gives rise to other artifacts, and image domain methods, which, as we show in the paper, do not utilize the information of the sinogram optimally, and the non-locality problem in CT persists. And finally, end-to-end methods, which work in both domains and therefore suffer on both ends. The transformation between the domains is done typically using filter back projection, or a learned version of it, termed sinusoidal back projection, or SBP, as is shown here. These methods are very hard to train, require huge data sets and incredibly long training times, and still, the transformation from the sinogram to the image is not optimal and does not address the non-locality problem. Now we move to our approach where we fundamentally address the issue of the non-locality in CT. We wish to find a better way to transform the sinogram into an image. And to this end, we propose a novel intermediate representation at the intersection of Radon and image domains, which presents the data in a local manner to the CNN and unlocks its full potential as a result. To do so, let's recall the Radon transform and filter back projection. Now, given an image F, the Radon transform is given by this equation, which is basically the collection of line integrals of the image at different angles and biases. Note that a given pixel in the image affects the sinogram entries corresponding to all the lines that pass through that pixel, which form a sinusoid in the sinogram. Now, the filtered back projection is given by this equation, in which each pixel in the reconstructed image is given by the average of its corresponding sinusoid in the sinogram. In our approach, we wish for the CNN to have local access to all the relevant information, i.e. pixels in the sinogram, for reconstructing each pixel in the image. Specifically, for each pixel xy in the CT image F, we wish to collect all the pixels in the sinogram that were affected by xy during the scan and arrange them along the channels dimension in a 3D tensor G at the pixel xy. To do so, we begin by filtering the sinogram with Grablock, and then we smear each projection along its corresponding angle to form different channels. We arrange those channels as a 3D tensor G. We showed in the paper that each vector-valued pixel in G contains all the sinogram entries that were affected by the corresponding scalar-valued pixel in the CT image F. We use G as input to the CNN and term our method channel back projection, or CBP. The idea here is to let the CNN access all the individual angles, since during either FBP or SBP, the contributions of the various angles are put together as a simple sum, and this isn't necessarily the optimal operation when dealing with a very small number of angles. So we'll leave it up to the CNN to decide how to handle it best. Now we run some experiments to test our method. To compare the different methods, FBP, SBP, and ours, CBP, we fix the CNN and examine its performance when the input is given by each one of those methods. We repeat this process for CNNs with different receptive fields and for different degradation settings. In our experiments, we chose the unit architecture and 3 variants thereof with different receptive fields. We devised 4 different experimental degradations in the sparse-view setting, where we only use 30 projections compared to 1 to 2,000 projections in the regular CT scans today. So this is a very extreme case. The first is the simple sparse-view setting, in which we gather only 30 projections of the patient spread between 0 degrees and 180 degrees. The second, noisy sparse view, where we also lower the intensity of the incoming X-rays, also 30 angles, which further lowers the radiation dose, but results in a noisier image. The third, blurry sparse view, as a result of the motion of the X-ray tube in the detector during the scan. Here, each projection is the average of a cone spanning a few degrees. In our case, it's 6 degrees. In the fourth, we simulate the effect of patient motion during the scan. And here, each of the 30 projections corresponds to a different shift of the patient. Now here is the PSNR performance in all 4 experiments. In the graph, each plot line corresponds to a different method, namely the CNN's input, FBP, SBP, and ours. The x-axis describes the receptive field size of the used network, and the y-axis describes the PSNR. Each point in the graph is the average performance of the corresponding network over the validation set, about 1,000 images, and the error bars correspond to the standard deviation of the mean. We can see that our method outperforms the vanilla filtered back projection and the SBP method, which learns a mapping from the sinogram to the image. Note that our method's advantage grows larger as the receptive field diminishes. Our method similarly outperforms the others in other degradation settings as well. Next, we ran 2 experiments in the limited view setting, in which the projection angles do not cover 180 degrees, but 120 or 90 degrees with 1 degree increments. And here is the PSNR performance in those cases. You can see that our method outperforms the others here as well. Now on to some visual results. Presented in the top row are the ground truth image and the naive filtered back projection reconstruction, and in the bottom row, the outputs of the trained second smallest CNN with different inputs, FBP, SBP, and ours. In the sparse view case here, note that our method successfully suppresses the artifacts while the others struggle, as you can see in the red zoom in, and it yields a much cleaner and more accurate image compared to the other methods, also in terms of PSNR. Similarly, in the noisy sparse view case, we can see this result again in the vertebra, for example, the yellow zoom in. Our method is again more accurate with less artifacts and better PSNR. In the sensor blur sparse view case, note that we got a much crisper and more anatomically accurate image here with better PSNR too, as you can see in the yellow zoom in. This is also the case in the patient blur sparse view setting. Our method also yields better results in the limited view setting of 120 degrees, as you can see in the zoom in and in the edges of the patient's body in the image itself, for example, in the upper left section, and also in terms of PSNR. And this is exactly the case as well for the 90-degree limited view setting. Now, we saw that for any network size, our method outperforms existing techniques. But note that when we increase the network size, we increased both the receptive field and the number of parameters. Now, which one of those is more important? And to answer this, we ran another experiment where we fixed the receptive field and only varied the number of parameters. As you can see, this leads only to minor changes in performance, and this shows that the important factor is indeed the receptive field. And our method makes better use of the information within its receptive field, and therefore achieves better performance. Now, to summarize, CT is an extremely valuable and useful tool, but unfortunately, the reconstruction quality is proportional to the radiation dose. But luckily, we can obtain relatively good reconstructions from very small doses using CNNs. The input data, however, requires some adjustment, since CT artifacts are highly non-local, and our proposed method solves this issue. We saw that incorporating our method in the reconstruction process results in better and more medically accurate images, which is of utmost importance. And finally, the dilemma between the radiation dose and image quality can be handled better using CNNs correctly. If you have any further questions, please refer to our paper or to me by email, and thank you all for listening.